Welcome to a new episode of Medicine in 3 minutes. As usual, we go straight to the point. The subject is bravely made clear and often illustrated. Let's start. Today's topic is about oxygen delivery. During this presentation, we will cover successively the delivery of oxygen on the floor and the delivery of oxygen in ICU. On the floor, it's intermittent ventilation. We start with nasal cannula, facial mask, venturi mask, no rebreathe mask, no invasive positive ventilation, high flow nasal cannula, BiPAP, CPAP, and for continuous ventilation and ICU, we will cover pressure support and assist control mode. Here's the ancestor bellows of mechanical ventilation. The airway are symbolized by a straw. The lungs are symbolized by a balloon. How it works? A fan with two ducts, one to blow the air into the lung, this one, and the other one is to drain the air to the outside. You have to choose between two parameters, pressure or volume. Two modes of ventilation. The first one is continuous ventilation. The second one is intermittent ventilation. Continuous ventilation does not allow for spontaneous breathing, like assist control or continuous mandatory ventilation. Machine is doing the work, not the patient. It's used when patient is sedated, paralyzed, comatose. As a consequence, there is asynchrony will not happen. Intermittent ventilation, on the other hand, allow for spontaneous breathing. The patient can breathe between the set breath. It is used when the patient is conscious and able to take a breath regularly. If irregular breathing, don't use it. For instance, intermittent mandatory ventilation. On the floor, you can use nasal cannula, facial mask, venturi mask, and no rebreather mask, NRB. Nasal cannula, it's 1 to 6 liters minute of oxygen. For facial mask ventilate is 6 to 10, and for NRB is 10 to 15. If IU2 40% here, facial mask ventilate is 14 to 80%, and for NRB is 80%. 40, 80, 14, 80. Here is a nasal cannula with two openings, one for to drive oxygen and the other one for to drive CO2. Nasal cannula is a low flow delivery system. It delivers supplemental oxygen to a patient in need of oxygen. This device is made of tube with two orifices placed in the nostril and from which flow a mixture of air and oxygen. The other end of the tube is connected to an oxygen supply. The cannula is hung around the air. It provides 1 to 3 liters of oxygen per minute. Next is about the face mask. Simple face mask is a low-flow delivery system. It provides oxygen therapy for patients who are experiencing lack of oxygen. Patients should be able to breathe on their own. They require a higher oxygen concentration than 21% found in the ambient air. Patients enabled to breathe on their own are placed on mechanical ventilation. The simple face mask can deliver higher flow rate than nasal cannula, 6 to 10 liters per minute, for an FiO2 of 40 or 60% oxygen. Next is about the ventilator mask. The ventilator mask, also known as air entrainment mask, delivers a known oxygen concentration to patient and controlled oxygen therapy. The mask was invented as a replacement for intermittent oxygen treatment, which was described as bringing a drowning man to the surface occasionally. Simple face mask, ventilator mask, no rebreather mask, and partial rebreather mask. A no rebreather mask, NRB, unlike low-flow nasal cannula, the NRB allows higher oxygen concentration. First of all, high-flow nasal cannula. There is an oxygen blender, an active humidifier, and nasal cannula. High-flow nasal cannula is useful in patients that are spontaneously breathing but have increased work of breathing, like in respiratory failure, asthma exacerbation, COPD, congestive heart failure, and spontaneous breathing during general anesthesia. CPAP, or continuous positive airway pressure, it provides a constant amount of support. PEEP, which is positive end expiratory pressure, in this example is about 5. The machine provides always 5 centimeters at least of water. The CPAP is used for sleep apnea, for especially the obstructive sleep apnea. CPAP is the equivalent of PEEP. We talk of PEEP when for invasive nasotracheal tube, and we talk about CPAP for conscient patients. Here's to compare between PEEP of 5 centimeters of water and PEEP of 15 centimeters of water. The tidal volume is the same, but we see here there is an increase of PEEP here. Why? Because there is a recruitment of alveoli. CPAP provides always a constant amount of support. PEEP, positive and expiratory pressure, is 0 over a number. The machine provides always the number. For this case, it's about 5 centimeters of water. This is PEEP. We use it in sleep apnea. What does CPAP do not give is pressure support over PEEP. CPAP equal PEEP. PEEP is invasive, but CPAP is non-invasive. BiPAP, B-level positive airway pressure. It provides a pressure support over PEEP and provide PEEP. It provides PEEP 5 cm, and pressure support over PEEP. BiPAP takes advantage of natural lung mechanics. During inspiration, lungs respond and compliant they are. When the pressure support is removed, the elasticity of the lung snaps back. That snapping back assists ventilation. PEEP is for oxidation. Pressure support over PEEP is for ventilation. Use it for patients that have difficulty getting rid of CO2, COPD. BiPAP, an asthmatic, it's very dangerous. It could kill them. During the next video, we will successively cover pressure support, assist control mode, peak inspiratory pressure, airways resistance, compliance, pressure plateau, auto PEEP, pulmonary ventilation, alveolar ventilation, and complication of mechanic ventilation. Thank you for watching this episode of Medicine in 3 minutes. Would you like to click the button like and subscribe? Your comments are very welcome. Thank you.